I realized that, neuroscience itself is just such a broad and vast area, and in the healthcare system, it's very much underserved. And part of that is just a lack of understanding of really how, our brains are working.
I think what we're going to see across the implant space is clever, novel, and innovative ways to use AI to create insights where we previously didn't have them, be it in the cardiac space, in stroke, in diabetes, in cancer, etc. I think what we're going to see is the emergence of smaller, more powerful devices that can collect more information, that train models to allow clinical insights to be uncovered and acted upon in ways we haven't seen in the past.
Similar to how the internet was 25 years ago, and I think we're in year one of that phase now. So I think it's up to us as a field, as a community, as patients, providers, industry, to work together to figure out what are the use cases, where does it add value. Certainly there's big tech involved in helping address things from a patient perspective, from a provider burnout perspective, from an efficiency perspective. And I think ultimately it'll come down to collaborations and then unique data sets and domain expertise.
But now, we're at this time period where there's this convergence of advances in hardware, in microelectronics, and et cetera, and now in software and our ability to analyze that data. And so putting those two things together, I'm really, really excited about, bringing along the next generation of companies that are really going to help us solve and tackle the challenges that have endured for many, many years in things like neurodegeneration, and psychiatric disorders. It's impacts so many people globally and has such a high level of economic burden. We need to be able to advance these therapies, and that's really what drives me.
I think 10 to 15 years from now, we'll see a totally different landscape. It's a tremendous opportunity for the medical devices and the patients. There'll be closed loop systems, there'll be implants talking to each other, there'll be direct to organ type of care, a lot of data coming out. There'll be so much going into the body compared to what it is today. It's really, we're at the cusp of a great innovation leap.